Premier Sisi Ntombela and Education MEC Tate Makgoe will this morning brief the media on the reopening of schools. They'll be joined by MECs for Health and Social Development, who will also give updates in the areas at work aligned to education. The briefing has already started. Mr. Makgoe is on the podium. Let's go there live.
Very regularly, almost once a week, sometimes 2 times a week, to receive reports on coronavirus issues and every other related issues that actually affect the disease. I must also say that as an Executive Council of the Free State, we have a social cluster. We are organized in terms of clusters. And then our cluster is called Social Cluster. And this cluster is led by Mayor Mamiki Kabati. She's the chairperson. And education is part of that cluster. Health is part of that cluster, and social development. So you will see that when we communicate now, you will see that this is a product of those 3 clusters. I mean, that cluster, those 3 departments have contributed or can continue to make sure that we are combat ready for the disease. So we approach it in an integrated fashion. First and foremost, it's very important to remember that the President has said that, you can go to the second one, yeah, that's just an outline. The President has actually made it very clear that we need to ensure that when we open schools, there must not be any infection happening in schools. And that is why there was so much effort to try and ensure that by the day we open, that we don't have, we are ready to ensure no child becomes affected because of our opening of the schools. And I must also say that we are opening schools because children must also learn. They must also prepare for the future. Remember, every child in South Africa is a national asset. And therefore, we cannot postpone school and say one day they will learn when coronavirus is not there. Because experts tell us that this coronavirus may stay with us for longer than we expected, 3 years. So there's no way we are going to allow ourselves that our learners miss 3 years of schooling. But also the other countries that have been more affected than us are opening up and making sure that they create mechanisms in schools to ensure that there's no infection. Therefore, that is our commitment, to ensure that there's no infection, to ensure that there will be regular screening of learners and teachers in our schools. So the whole issue of hygiene would be very, very important in our school. Just on the next slide. So here what we are saying is that you will see when you go deeper into the presentation that working with health and social development, we have developed or we have linked schools to specific nurses, to specific healthcare facility, to specific social worker, so that they can be able to deal with the health issues if they emanate, or even the psychosocial services or psychosocial support if it is necessary or when it is necessary. Somebody, I think on national TV, asked a question about how do we train the society, or how do we contribute in making sure that we interact with various stakeholders. We can confirm, as you see there, that in this whole process, we've been interacting with teacher unions, principal councils, SGB councils, SGBs, and many other stakeholders in education. But what is even more important, we then developed Z folders. I'm sure we can, Howard, give everybody a Z folder here with enough information on COVID-19 so that our children can have this information in their pockets. We have also produced about 5,000 flyers and 10,000 posters, right, that will be posted in schools so that if learners are walking around the schools, they can always be, refreshed about the issues of COVID-19. We have also used community radio stations to publicize our message in terms of promoting health and safety. You will see there that what we are just saying there is that we have extensively interacted with various important stakeholders. Executive Council, for example, PROPEC, you remember the legislature, portfolio committees, and so on, SGB councils and so on. And that the purpose there was to try to take everybody with us, because we have realized that in this era of social media, there is so much that people can say on social media that is factually incorrect. Therefore, we have to make sure that most of our people understand where we are coming from. Those are the examples of the Z card that we have produced. Those are the examples of the posters that we have produced, and then they are very, very detailed, and they are in our schools. And also, we continue to engage on social media, newspaper adverts, WhatsApp groups, and so on. So we continue to try and make sure that we are in the media space just to communicate what needs to be communicated. We were asked a question, I think, on national TV on Sunday about the vandalized schools. So we thought that we must also tell you that indeed we did have vandalized schools in our province, and therefore we'll actually later just tell you how we are going to deal with those issues. One of the critical issues was the issue of provision of water. Let's just go for water. Yeah. We can confirm that in the province, you know that we had very serious challenges of water, especially in areas such as Kwakwa, Harib, and now I'm told in the Eastern Free State, other parts of Friede, and so on. And then we can confirm that indeed 32 schools in Harib receive water storage tanks, 55 in Taumfutsanyani, and this was done through the Department of Water and Sanitation, using their agency Rent Water. I think they gave us a total of more than 180 of these in 87 schools. It's important also just to talk about the issues of mobile classrooms, because we know that question is going to come. Remember, this is the first phase. The learners are going now. This is the first group of learners that is going into to schools. But the beginning of July, if everything stays the same, hope that there's no upsurge of the disease, the second phase, an even bigger one, must come in. Much more challenging, because it will be bigger numbers. Just this week, we accepted almost 90,000 learners in the province of the Free State, various areas, and then the next wave will be much bigger. The total number of the learners in the Free State is more than 700,000. So you can understand that we have to do all these things that we've been doing over the past few weeks, we have to do them double. So one of the challenges that's going to come is the challenge of overcrowding, right? So we have to prepare mobile classrooms. So already those mobile classrooms, you can see, have been ordered, and the deliveries for now are at 62. So 62 of the 98 mobiles have arrived. And then on the vandalized schools, you see that over the COVID period, we had 72, over the lockdown period, we had 72 schools that were vandalized. And all of them, we have put contractors there. Fortunately, we had a team of contractors that is already appointed in the department we could quickly, link them to schools, and they are already working in terms of repairing that. Others have finished. I'm sure some of you went to some few schools and found that there's been a big change. SABC was trying to hit me, and I said, no, they don't know I'm a guerrilla. I'll find a way of solving this thing very quickly. But it shows that those contractors are there. So even here, you've got, because it's winter, you've got schools with damaged doors, broken windows, toilets, and so on. Even there, the contractors are there. So Free State schools are a construction site. But you all know that one of the biggest problems is the problem of theft. And therefore, after working on those schools, we know that people will try to go and steal some of those things that will be used in the schools. But we really are working very close with the Department of the Police to ensure that we protect our own schools. And then on the next slide, on the COVID essentials, we just want to confirm that all those basic hygiene essentials were delivered. Sanitizers, disinfectants, hand soap, infrared scanners, and cloth masks. I must say that there has been an issue raised, HOD, on the issue of the accuracy of the scanners or the thermometers. Health has actually advised us that we must also have these old thermometers, the Mercury one, so that if there is some variance in terms of the temperature, we can have per school 1 or 2 other thermometers that could actually just verify the more accurate one. So we are looking at that thing because we really want our children to be safe. And that is the most important thing that we want to convey. You realize there that we also talk about the face shields that we will be giving to teachers. The procurement process has started because we don't want teachers to teach with the face mask because they may not be able to be heard by the children. So we think that those face shields will be much better proposition. So there you are just seeing that, where are we now? We are on the schools, yes. Yeah? You can see that, no, they have moved. Okay, let me do that because all the slides just indicate that we have done what needs to be done until they talk about the cleaning. But the point I want to take is just, if you look at the cleaning of the schools, all our schools have been cleaned. That's all our schools in the deep cleaning. Yeah? And we don't have those caves that people were talking about for the children. We don't have that in our schools. And then I want us to move to just move on. Let me see the slide. Move on again. Yeah. Those are the. You see, even with the hand masks, cloth masks, we are now fine. We are giving every child 2 masks, every teacher 2 masks in all the schools. Right? Can proceed? Yeah. Yes. No? And then we can then move there. We can see that one of the things that we want to communicate is that we really want to thank our parents and SGBs for the role that they played, and community members in general, for the role that they played in cleaning our schools. So our schools were deep cleaned. The schools were closed for more than 2 months. There was no virus there, but we had to deep clean them. But we have prepared ourselves that if there is a need for if there's an outbreak and there's a need for fumigation and so on, we are ready. We've got necessary chemicals. We are ready. You can see also that social distancing was done in most of our schools. Learners are not sharing a desk. One child, where there's an X, it shows that the child cannot sit there. And then where there is you can see the marks in the classrooms. You can see all of them is 1.5 meters. So social distancing was observed on a regular basis, yes. And also, it's very important to mention that we have also been training our teachers, our learners, in many instances, including our parents, have been trained on COVID-19 health promotion and screening, right? They've been trained on all those things. They've been trained on social distancing. Our principals have also been trained and engaged in re-engineering of the timetable, because the timetable now has to change. It can't be a normal timetable, because now classes are smaller, learners are very, very few in the classroom. So some of those things we had to make sure that they are trained. And the non-teaching staff, all of them, cleaners, NSNP, Batwafananga Dijo Savana, and everybody else have been have been trained also on infection control, so that we ensure that we minimize any other risk that may come. You would also see that we have appointed a number of cleaners in our schools, and the norm that we used was one cleaner per 250 learners. So schools, were allowed to appoint additional cleaners using that formula, and a total of 1,855 extra cleaners were appointed. And then on the screeners, we also appointed one per 250, and a total of 2,838 were appointed. So I think with the issues of orientation, we are happy that all the SMTs and teachers are ready. They've been oriented in all our districts. Just on the next slide, you'll see the breakdown of the numbers I was talking about in terms of the number of cleaners and the number of teachers. And this is what Gauteng calls COVID-19 brigades. But as it was said earlier, different provinces use different terminology. So what we did here, we said schools must identify young people around where they stay. But we also note that in many schools, there were already a lot of volunteers. There were already many volunteers in schools anyway. So these are the young people that have been appointed to help for this 3 months contract, to help deal with issues of screening and cleaning and so on. Yeah. And then just go on, the next one. Here we can just confirm that the Department of Health have trained all our teachers or non-teaching staff. They've trained the cleaners, they've trained the screeners. All of them have been trained with the assistance of the Department of Health. There's our schools. That is about the number I've spoken about. That is the number that I'm talking to there in terms of we cannot have more than 20 learners. Some classrooms are much smaller, actually. Some classrooms, when I was in other areas, they could only take about 12 to 15 learners per classroom. So it's not the minimum of 20. Some classrooms are much smaller than that. So we are actually making sure that social distancing is observed. Next slide. Yeah, those are the documents that have been given, the manuals that have been given to the schools, to circuit managers, so everybody knows what a standard operating procedure is. If there are problems in terms of if there's an outbreak, if the child gets sick for whatever reason, principal, everybody knows what they must do. And that's what the standard operating procedure talks about. Social distancing, deconcentration of classes, they all know that we have to observe that is the requirement from the President and National Coordinating Council. The most important program that we think in the province is this one of integrated school health program. Because I've agreed with the minister, with the MEC for health, that going forward, we are going to ensure that we strengthen our integrated school health program, such that it does not become a thing only during this period of COVID, but health is reintroduced in our school. We've got classes of life orientation, we've got SBSTs in our schools, and we think that this will be a legacy. Proper health outcomes through integrated school health program must be one of the outcomes of this period. And next, you will also see there that, oh yes, all what we are saying there is that in terms of screening of learners, the Department of Health has been part of the process, but also you'll see that we are now including social workers for psychosocial services. If you go on the next pages, if you go on the other pages, you can just go slowly on those pages, just go on and on and on. But you'll see that we are now showing you the number of schools, the clinics, and then the social workers that are linked. So we are linking a school, like for example in Makgoe we've got Bloemfontein with number of schools 124, and how many clinics do we have? We've got we are linking them to 10 clinics, and then facility managers. They'll be linking with various schools, and they will have a number of social workers, and then 8 our schools. We've got school-based support teams. These are professional teachers who actually look at the health of the learners themselves. So we can just go through that one because it's just different provinces, just different districts. Now, one of the big one is the issue of learner transport. And it's big, not now, it's going to be big in the second wave. We need to prepare for it much better. And then one of the complications was that before last April, this was the responsibility of the Department of Roads and Transport. Now this responsibility has now come back to us. So there's small little challenges in terms of contractors and working with people there. We are sorting them out. However, in the interim, we have appointed those who have been doing the work to continue to do the work as the processes of procurement are being resolved. So we've got around 188 vehicles that have been sanitized by the Department of Transport. The Department of Transport makes sure that the learners who are traveling in this thing are also safe. Yes, now one of the most important reasons why children go to school is to eat. Our NSNP program, National School Nutrition Program, we are ready. We've always been ready. Remember that our NSNP in the province, we work through the schools, through the SGBs. It's very difficult to try and buy for everybody, more than 1,000 schools from a province. So we are working through the SGBs, and they are able to give children good meals. So all of our learners who are at school now will be able or are able to access food You can go to the next slide. We are ready. Funds have been transferred to schools. Staff has been trained. And so on. PPEs, masks, gloves, all those things that make sure that this proper hygiene has been delivered into our schools. Now, the issue of social development that I spoke to a little bit earlier, you'll see that we had planned to appoint 52 social workers, right? And then as a department, but we did not yet have money. But then we spoke to the Department of Social Development, who has already now appointed 92 social workers, and they've said they are going to allocate 52 of those 92 social workers to our schools. So you can see that the last additional 52 social workers will be allocated for psychosocial support. Because this disease is going to be traumatic. When children face death, when somebody dies in the family, children are going to be affected. When a teacher gets affected in the school, when learners get affected in the school, you are going to need those psychosocial services. And we are very, very happy with the support that we are going to receive from the Department of Social Development. They are there already. The deputy minister, the deputy president was here on Friday, and then the MEC for social development, they've appointed them, they've given them the letter. So I've seen them with my own eyes. So we're not talking theory here. The other thing that is important in our standard operating procedures is to ensure that we have sick bays in our schools. We've got sick bays, we've got also isolation rooms. So at least those sick bays, if there's somebody who has been taken to a sick bay because they're sick, they will be taken care of by a healthcare provider and of course a social worker. So those sick bays are there in schools, and some of them are not yet, in terms of all the equipment, they're not yet all equipped, but we are working towards making sure that now this is a sustainable solution. The issues of examinations, I think there's been a lot of discussions about examinations, but I can just say that you know that examination has been suspended for June. All the exams will be done now in December. So I don't want us to spend more time on that one, but exams are very, very important. We must just raise the point that our grade 12s have to cover the whole syllabus, because you can't go to university with half knowledge of grade 12 of your first 12 years. So that's why we have to make sure. But the other grades we are going to restructure so that they can just be taught the most important aspect. And then time allowing, we'll be able to catch up with the other issues that needs to be caught up with. So the exams, we are fine, we are ready. And then on the 8th, we just thought that we must just give you a couple of pictures, nice pictures about our learners in our schools as they were going to schools. You can see that schools have been very innovative. Just go back a little bit on that one. You can see that schools have been extremely innovative, that just next to each and every class, there's water and there's soap, so that now if learners they've missed out cleaning their hands, before they go into the class, they must clean their hands. So the whole issue of hygiene remains the most important. So you can see now, just go back. You can see those teachers now are wearing those face masks. And I can say that despite few challenges, maybe there and there, there's no way you can open up a system and there's no challenges. Most of our teachers are extremely happy. This one you saw, it was just National Readiness Dashboard. But if you go to the next one, you'll see there's the Free State. And you can see that on all the criterions that were used to measure all the schools, the Free State had green in everything. So we worked hard. We were not communicating with you. We want to apologize, but you can see why. Because we had to go and do the work and come talk to you a little bit later. So thank you very much. We have said those things, but I can tell you that yesterday when we started, we were just collating the numbers now, but all our schools opened, right? There was one school here in Mangaung where we were waiting for the results of the teacher, one person or admin clerk tested positive, and they had contacted with other teachers, so we had to be proactive and make sure that now all the teachers are checked. So they did not open necessarily yesterday, children went back home, but the teachers have been cleared. That was a week or so ago. The teachers have been cleared, so the children will be going to school. I was also a little bit worried about a place like Harib. Everything went well. All the learners went to school. Betuli, a new epicenter, we checked it, and all the children are at school. And then Faisle Dabi, excellent. They've been, galloping forward more than everybody else. Lejoli Putswa, they also were very, very happy. There was a video doing the rounds about one school in Hoopstad. We sent the district director to go and check. We checked that was fake news. The school was ready. In fact, that video was made 2 weeks ago. But we welcome these things because it allows us to go and check whether these things are correct or not. Taomfusanyan is one area that was worried about. And Taomfusanyan is ready. Everybody went to school. We do have a small problem in Friede, I'm told, with the supply of the water. The tanks are there, but with the municipality, we have agreed with them, they'll supply the water. There was also a small problem in Paris to Mahole. A few schools, we did not have water, but the water was delivered on Sunday. So I think we want to use this opportunity to thank the support of my colleagues in the Executive Council, the leadership of the Premier, the support of the leadership in municipalities, the media, and everybody else. But even more important, our teachers, their organizations, the unions, the parents, and we really want to thank you. We know that it is not going to be easy. We know that things may go wrong, but what is important is we are determined to make sure that nothing goes wrong. Things won't go wrong because of our negligence. Things must go wrong because we could not control them. But even if anything can go wrong, we are battle ready to be able to save our children, because our children are our future and they are a national asset. Thank you very much.
Thank you very much, MEC. Can I also take this opportunity to welcome MEC Tate, who has just joined us. And unfortunately, in terms of the program, I will humbly request MEC to ascend the stage. Yes. Thank you.
No, thank you very much, Program Director. Let me greet all the media houses that are here. DG, we thank the platform that you have created for the three departments, the Department of Education, the Department of Health, and the Department of Social Development, to talk about our readiness for the opening of the schools. so that we could give the Free Staters a confidence in terms of their children that they're supposed to part with and send them to the schools. We have been following all the media reports, including social media reports about the concerns that the parents and the learners were having, and we tried by all means to respond to issues that were raised as concerns. As the Department of Social Development, it will be important to note that we have just rounded up the Child Protection Week campaign under the theme, "Let us all protect children during COVID-19 and beyond." The significance of the campaign was to create awareness of the risks that children face during these trying times of COVID-19 pandemic. As the department, we are aware of the impact of the closure of the schools on the children because we are mindful that most of the children had their only meal from the schools. And now when the schools are closed, they were not able to access the meal. And most children had the school as a place where they had a peace of mind. We are mindful of such things. So the Department of Social Development had to respond to ensuring that the children do still access a meal when they are at home, and we also had to ensure that we put mechanisms that are protecting the children against abuse when they are at home. Now, which means that we had to go an extra mile. We need to introduce innovations. We had to incur extra costs in terms of dealing with this new challenge that is facing us, that all of us did not know that at this time in point the world will be turned around by the COVID-19. Now, in the department, we have what we call CNDCs, Community Nutrition and Development Centers, what you commonly know as soup kitchens. Now, these CNDCs, when there was no corona, they would cook and feed the individuals. But with the challenge of COVID-19, taking note that there are also children who are no more eating at the schools, we had to take from other budget items that are not operational and include on the CNDC's budget to ensure that they now feed families, not necessarily individuals. We had to buy food parcels for them, for the whole family to benefit, knowing that if you have bought food parcels for the family, the children who are not eating at the school will now have a meal at home. It's one of the things that we introduced as a department. With COVID-19, we are going to embrace the new normal. We are going to work differently as the Department of Social Development, which is a custodian of the Children's Act. We have now gained access to the schools, as MEC Makgoe is presenting, where social workers are much needed. Today, I stand here proudly to say the Department of Social Development, as MEC Makgoe has already alluded to you, have appointed 92 social workers. Of the 92 social workers, 52 social workers will be in the districts working with the Department of Education to support for psychosocial support. It will be inclusive of psychologists and social workers from the Department of Health and from the Department of Education. And this is how they will be spread across the province. Mangaung Metro will receive 12 social workers. Thabo Mfutsanyana will receive 12 also. Lejweluputso will receive 16. Fezile Dabi will receive 6. And Karib will receive 6 social workers. Now, it is important for the Department of Education, MEC Makgoe, and the principals, the teachers, and the SGB, including the parents, to know that the social workers in the employ of the Department of Social Development have statutory powers, because we are the custodian of the Children's Act. They have statutory powers. They can take decisions which does not need consultation if they realize that a child is in need, a child is abused, a child is not getting proper care. They are able to take action there and there. So their deployment to the schools will not only afford them an opportunity to provide psychosocial support services to the learners and the teachers who may be infected or be affected by COVID-19. These social workers will also provide a basket of childcare and protection services, which may include early intervention services, especially for the child-headed household. The Free State Province acknowledges that COVID-19 will be with us for some time to come. This coordinated effort will still be necessary until the curve is flattened and beyond. It is upon this reason that I have extended the social workers contract from a 3 months to a 1-year contract in order to ensure that there is proper provision of services to learners, teachers, and communities infected and affected by the virus and beyond. We will also, in the same manner, work together for readiness. In fact, we have started working for the readiness of opening of the schools. We will be looking at the readiness of opening of the early childhood development program, the CREACH. We are already working on them, preparing, whether the date is there for the children to go back or not, but we are already readying the creches, the ECD centers for their opening, because we need to be proactive in terms of our work. DG, program director, media houses, this is what we have been doing as the Department of Social Development, what we will continue to do to ensure that COVID-19 pandemic does not swipe us away, but we outlive it. Thank you very much.
Thank you very much, MEC Tate. Ladies and gentlemen, at this stage, I will humbly request MEC Health, Matthew, to ascend the stage. Thank you.
Thank you, Program Director, DG, my colleagues, MEC Education and MEC Social Development, all officials from the government and partners, the labor movements, if any are here, and the different media houses. Ladies and gentlemen, Ntombela, we are once more in this difficult time of COVID. We are here now to outline the Free State Provincial Government plan in ensuring that as the learners return to school, we are ready. The war against COVID can never be won by one department or one person. This is something that we need to hold hands together so that we are able to fight it, MEC social development, so that COVID-19 does not kill us. As the Premier and the MEC of Education, in fact, had said before, the grade 12 and 7 started yesterday successfully with their schooling, and throughout the whole province, MEC Education said so, that we were all ready for them, we had prepared well for them, so that is why all the schools were open yesterday. This is even when we are facing this devastating situation, and we are busy fighting this invisible enemy, COVID-19. We know that COVID-19 instills fear and uncertainty amongst the communities, even amongst the health workers, and the world at large. So, because of this, we know that we need to make sure that we take psychosocial of all the people that work and fight, the frontline workers of the Department of Health. That is why we have, from today, ensured that we assemble a team of psychologists, MEC Education, that are going to be helping our healthcare workers, because we have seen that there's fear, there's anxiety amongst our workers, but not only them, but even community, because of this COVID-19. The lessons coming from the coronavirus pandemic are that we must all, like I said, hold hands, plan together, and be guided by the spirit of humanity and fighting our challenges. This should be done across the split of color, ethnicity, wealth, and gender. All are eligible for universal access to quality health care. It should be and must be health for all. In the Free State, we started with a very scary situation, if you know, around this coronavirus. We started with a scary situation where infections coming from the church spread like wildfire. And all the index cases that we have the relationship with the said church, and it was imported from abroad. Yesterday, on the 8th June 2020, we had 364 confirmed cases. There was an expectation after that exponential curve that we saw starting from the church, that at this point, the Free State would be there at around 6,000, 5,000 people having tested positive now. But we are happy that we're able to contain the spread of the virus to an extent that we are still at 364. Regrettably, we lost 9 people related to COVID-19, and may their soul rest in peace. The number of cases confirmed to this date, according to our 5 districts, Bangaung we have 195, Karib 76, Fezile B is 39, and Tabamfutsanyana 35, Lejoliputua is 19. This is as of the statistics of yesterday. Like other provinces in the country, it is clear that our province is in trouble. If the virus is not contained, it has the potential of causing havoc and panic amongst the communities. Albeit the spread from the clusters and spillage from contaminated areas in the Free State, we experienced an unexpected increase in some of our smaller towns, such as Betuli, Heilbron, and Ladybrand. The valuable lessons learned from these areas made us to better understand the behavior of the virus, so we could come with better strategies. We have since learned that active and targeted contact tracing, supported by screening and testing of contacts, can pay dividends. This we learned from the day we had the first person that tested positive in the province, where we aggressively went for screening and testing and tracing of contacts. The way we managed to reduce the speed and the spread of the infection, especially here in Bloemfontein, it came with a lot of energy, planning, working together, and guidance from our provincial command center under the leadership of our premier. Lately, we have seen the importance of screening and testing in patients that are the patients that are in our facilities. And we even went to an extent of swabbing people that would have died, even though when they came, they were not showing any signs and symptoms of corona, especially those with cardiorespiratory illnesses. And that has helped us because after we swabbed the corpses, we were able to find the results that are positive. And that then said we must go then into the communities where these people come from so that we are able to trace the contacts and also contain them, quarantine them if necessary. It's a unique innovation that the Free State did because I think it helped us to be able to trace the silent transmission of the virus within the communities. Because if a person had died and we did not check this corpse, we would not know that there are people, his contacts, that are still in the communities that had acquired this pandemic disease. Coming to the readiness of the health system in the province, in as far as the return of learners to the basic education school, we had a joint plan with the two departments, Department of Education and Social Development. That is where we then agreed that as a social cluster, we had to start the processes of strengthening our systems, like the MEC for Education said, by appointing the social workers that will be there to assist with the psychosocial problems of the learners and their families. We also appointed the professional nurses and enrolled nurses that will ensure that they helped our teams of community health care workers. Our approach would be that of the primary health care re-engineering, where we then strengthen the integrated school health program. We said we are starting this now as a way of strengthening our health system even beyond the COVID-19. This is something that would then remain as an important feature, making sure that we take care of the health of our learners. It was indeed the responsibility of Department of Health to ensure that they take care of the school health of the learners. It had not been happening, like we were not covering all the schools, but at this point, through the planning of the three departments, all the schools will be covered by our re-engineering team, together with our social workers and also the environmental health officers that would be taking care of the environment around the school or even within the school to make sure that we take care of the social determinants of health within the school premises, not just the COVID-19. This we do, as you know, that in the spirit of the National Health Insurance, we must make sure that we practice the primary health care and we make sure that we take care and deal with the social determinants of health, because we want our learners healthy. We don't want our learners to leave the class and then go to the clinics during the school time, but we will make sure that the health workers at all times are ready to assist the teachers to take care of the health of the learners. Our trained healthcare professionals are working together with the officials of the Department of Education and also the Social Development to take care of the learners and the teachers. Educators and personnel from school receive training, like MEC Makgoe said, from the officials on how to manage the COVID-19. The training included how to identify the suspected case and how to refer accordingly without spreading the infection within the school. The training also included how to use the personal protective equipment, such as face masks, the thermal thermometers, the hand washing and the social distancing, the quarantining and isolation. As MEC Makgoe said, we have already prepared in all our schools the sick bays and the isolations, where if, say, the teacher or a learner then tests positive or is suspected of or is having the symptoms of COVID-19, is immediately isolated, and the health personnel make sure that they would do the swabbing, and the person that would be under investigation would immediately be referred to the relevant isolation closer to the school. With our ward-based health teams, we are supporting school in each ward across the province and make sure that they receive the necessary health support. The department is also planning, like we said, the psychosocial support, whether of the people that will be having infected people at their homes. If a child the mother has got is infected, we know the stress and the anxiety that the COVID-19 is causing our people. So the people that would be taking, our psychologists together with the social workers would be working together to ensure that we help the family as well as the school. We know that coronavirus is it's new and unknown strain that causes fear, and currently we know that there is no treatment. There is no assurance of how long it will take before we can find the vaccine or even the treatment. Therefore, it demands of us to adjust to the new normal and consider a serious change of lifestyle and attitude. We have to be able to deal with the virus and live with it, but make sure that we stop the spread. Lastly, the recent infections that we saw in our province is of our health workers in the public facilities. We have one in Karib and others in Tabamfutsanyana in Manapo Hospital. And we have 9 in Manapo Hospital that we found yesterday. There was one worker that came infected into the facility, and unfortunately, so when we traced the workers that had been in contact with this person, 9 of them were tested positive, and we are already ensuring that we are decontaminating the hospital and making sure that we also do further screening with other workers, but not just at the facility, but even at home, because some of these workers would have gone home. Already our teams have been unleashed to make sure that we trace and screen every other contact that would have come across these workers that have tested positive. Together with our occupational health nurses, the infection prevention and control nurses, the unions in the bargaining council, we are standing side by side in fighting this coronavirus. We are also working together, even in the health system, together with the sister departments, Department of Education and Social Development, and supported by our provincial command center. So together, this pandemic will be stopped in Free State. I thank you.
Colleagues, we have come to, in terms of the program, to discussions, or if you like, questions and answers. We will be dividing our question and answers into 3 categories. We will have a question from the floor, colleagues who are here, and then we have also issued a WhatsApp line where people can post their questions. We'll also have Zoom, a question where our panelists, the leadership, will respond to those questions. Without further ado, We will start with the question. We'll start at the floor. We'll allow about 5 questions, and then we'll then give the chance for the leadership to respond. But can I kindly request that as and when you raise your question, can you also indicate the name of the organization you're coming from and your name as well? We'll then take the question. We'll have 5 questions for now. And then I'm sure there's a roving mic, so that colleagues can be audible enough for us to catch those questions. It's over to you, colleagues, for the questions on the floor. Okay, that's Refilwe. Refilwe, can you come in? Where's the mic? Oh, okay. Thank you very much. Palace, I think you. Okay, thank you. Okay. Is there any... Okay. And Tate now? Okay, thank you very much. Colleagues, can we limit the movement there at the back, please? I think was there a lot of questions that emanated from individual people. I will then take this opportunity to ask the panel to respond to these questions before we come to the next round. I'm sure I'll start with the MEC Education just to respond to some of the questions that have been raised. Yes.
No, thank you so much. No, I was just double checking. I don't want to say something here and then you go out and try and find out the MEC was not telling, but the MEC was not telling the truth. Now let's start with thanking you for all the questions. I am going to try and cover others, and others I may not be able. Maybe if Howard allows, we can ask the HOD to maybe add there and then. But it is very clear that teachers who have comorbidities, who've got challenges of diabetes and all those and so on, some of those, both asthma and so on, have to get a letter from their doctor that says they are at a higher risk of getting COVID-19. And once they are able to present that, then we are able to process it as a Department of Education to say they can now work from home. Right? What is yet not clear, because standard operating procedure says that they can work from home partially or fully. So it's very clear that there's confusion there. But you must bear with us. These are new conditions, right? As long as we all understand that the principal idea is to ensure that the teacher does not get infected. Principal idea is that they don't infect the learners. Safety issues come first. We may make concessions there and there, or maybe bend backwards there and there, in the quest of making sure that the learners are safe. But at the moment, teachers who have presented letters from their doctors are being processed, and they would be, asked to work from home or to do that. But I must also say that there's quite a number of teachers who've got hypertension, who've got this, who are still fully functional, right? And they feel that they're functional. So as long as doctor can say this person is functional, hypertension that they have is under control, that teacher must be able to come to work. There's many people here in the leadership who've got diabetes, who've got all those diseases, who still continue to work because they love what they do. So I know that the teachers in the Free State love what they do, but we must make sure that they are safe so that nobody does not die unnecessarily. I hope I understood your question, if that's what you were referring to. You need the number. No, we are working on the numbers, right? Because the applications are coming in. The applications are coming in, so we don't have the numbers yet. We have not confirmed all the numbers, but I can just confirm that the applications are coming in, right? Yes. And then on the school in Mangaung here, I was looking at the district director, but I think it's Butchabela Primary School, right? Is it correct? Yeah, that's Butchabela Primary School. What had happened here is that a week before, or is it last week, right? They found that one of the admin clerk, right, tested positive, and this person had interacted with teachers because teachers had actually started at school. So all what you needed to do was to go and test those teachers. The tests are out, and the school can start. So everything is okay. Or the second manager is just sitting behind you. So he says it's correct. That is correct. So everything is correct. I think they'll be going to school on Wednesday, isn't it? Is it Wednesday? Yes. So they'll be going to school on Wednesday. And then there was a question also about special schools. One of the things about special schools, there is also a committee of the special schools that are working with HOD. I know HOD is very, very passionate about that. The special schools, fortunately, they normally, because they've got small classes, social distancing already is not a major problem. But indeed, they've got other professionals. Remember, they've got nurses, they've got psychologists, social workers, and so on. So they are more organized. Yet there is also problems where the severity of a disability sometimes causes that you must have contact. So for those, we need to provide proper PPEs like we provide in health. So that now if you have to feed these kids, you have to go closer to them. Those will be provided so that now they can be able to execute their jobs. Right? And then, yes, there will be extra measures, as you said, because you can't avoid that social contact, right? Then there was a question you asked about parents. This is a very complex one, right? Firstly, the South African Schools Act, the laws of this country, says any child between 7 or 6, whatever, grade 1, to 15 years, they have to be in school. If they are not in school, you have to arrange provision to support them with education. And that's why Minister was saying you may have to arrange for homeschooling. So if anybody says, look, I want to teach my child, I don't trust the system.
We're coming out of that crossing to the Free State, where the almost national conversation really about the readiness of schools in terms of responses to COVID-19. We'll continue to unpack that story throughout the show and with follow-up shows. You're watching The Agenda.